Hello, I'm Peter Feys. I'm a professor in rehabilitation science and physiotherapy, and I'm chairman of the organization RIMS Rehabilitation and MS. We are very pleased this year, in 2016, that we have a joint conference with ECTRIMS. So during this conference, we have 3 sessions where we could put forward more holistic themes in rehabilitation that are relevant as well for patient care. I just want to briefly go through the sessions, and the first session we had was about multidisciplinary rehabilitation. We presented the largest study so far on the effects of inpatient care. It's a study from Denmark where 400 patients were enrolled and where we have seen the results on quality of life and on European quality 5D. Jenny Freeman from the UK also has presented the evidence we have so far in progressive type of MS. So we know that we have medical treatment for relapsing or remitting type of MS, but there's few treatment options for progressive MS. And multidisciplinary care can play a role there. And Jenny Freeman has very nicely summarized all the evidence that is present nowadays in that area, which is going from physical rehabilitation to vocational rehabilitation, arm rehabilitation, and cognitive rehabilitation. And the last session was about behavioral change. You can do a therapy, but in rehabilitation you have to practice a lot yourself. So impacting on behavior and making people doing more in daily life, being more physical active, is something we value very much. The second session was about symptomatic treatment. So there we had 2 symptoms that we highlighted. One was fatigue and the other one was cognition. The fatigue management is very important, and there have been studies on cognitive behavioral therapy, on exercise therapy, on energy management programs. However, studies have never compared these interventions actively one to the other. So we had the presentation of Vincent de Groot of the Vrije Universiteit Amsterdam, where we saw a direct comparison, an RCT, where these 3 options have been compared directly. So I go have a look to the web pages to find more about the TRIFAM study. There was also a summary of cognitive rehabilitation, all techniques that are being applied in retraining, but also in a holistic rehabilitation context. And then finally we had a room session on neurobiology and rehabilitation. So we are very much intrigued whether cognitive rehab and motor rehab is impacting on the brain. It makes maybe for larger volumes of specific areas in the brain or cortical thickness, but it can also make that the structures and the integrity of the structures is much better after interventions. And if so, the question is then how long is that preserved? So it's an exciting area, it's a new area, and it has been very well summarized by Dr. Prakash, by Luca Prosperini from Roma, as well as platform presentations from myself, from Maria Rocca, and other presenters like Victor Mark from the United States. I hope you will enjoy these topics.